Hi everyone, welcome. My name is Danielle Mason. I am in the quality department here at Sturdy, and I just want to thank everyone for coming out today. We have some really great speakers that have given us their time and to share their stories with us here. So I get the pleasure to introduce, first we have Dr. Patel, who's our Chief Medical Officer and Chief Quality Officer here at Sturdy. Can I just ask everyone also to put your phones on silent if you haven't? And just to our speakers, I did let them know too, but we do understand that we are all still working. We might only have 30 minutes for lunch, so please feel free if you do need to get up and go back, that is okay. So thank you for coming.
Good afternoon, everyone. How's everyone doing today? Thank you all for coming today for what I think will be an amazing discussion about organ donation and its impact on those receiving donations in honor of National Donor Life Month. As many of you may be aware, at any given time there are over 100,000 individuals awaiting life-saving organ transplantation, and sadly an average of 15 patients a day die awaiting organ transplantation. Our mission at Sturdy Health, as you all know, is to improve the health and well-being of the people in our communities. This aligns perfectly with the mission of New England Donor Services, which is to save and heal lives through organ and tissue donation. I'm proud that we can partner with New England Donor Services to accomplish just that. Working in close collaboration, NEDS has been able to screen over 300 patients at Sturdy annually for potential organ donation, and this past year we had 2 patients who successfully provided organ donation and 20 patients who provided tissue donation. The Sturdy team and NEDS ensure that we maximize our ability to evaluate patients timely so that any opportunity for organ and tissue donation is reviewed. While the benefit of donation seems clear, I don't think that those of us who have not been directly impacted by this process truly understand the impact donating has both on the families of loved ones who donate and on the recipients who are lucky enough to receive these organs that are donated. I personally have been lucky to witness in my own family how a kidney donation transformed one of my family members' lives and allowed them to return back to a life not hindered by medical care, dialysis, and any associated complications. It was truly transforming for my cousin. Similarly, today we'll be hearing stories from the perspectives of both the family of loved ones and donors themselves, which I'm confident will make us all think differently and appreciate more the donation evaluation process the next time you may or may not be involved in that process. So thank you all for joining today, and thank you to all of the speakers who took their time out of their busy schedules to come tell their stories to us.
Thank you, Dr. Patel. Next, I have Kent. Kent's brother Dan passed away at the age of 43 from a brain aneurysm. During this difficult time, his brother's family found comfort in knowing he helped others through donation. Kent shares his family's story to help others better understand donation and how it can help others. Please welcome Kent.
Hi, everybody. Honored to be here today. New England Donor Services reached out a couple months ago, and I was more than happy to share the story of my brother Dan. I'm from North Attleboro. I was raised here, and I've been at Sturdy a lot. Spent a lot of time here as a kid with medical emergencies or sports injuries. My 3 children were born here, and my wife Julie just started working here last week. So it's a great place, and I'm happy to live close by. My brother's story, Dan was born he graduated high school, North Attleboro High School in 1991. He's 6 years younger than me. That's a picture of him and his wife, Deb, in the middle there. He went camping with his family in 2016, August. His wife woke up to him having a seizure in the tent. By the time the ambulances got there and everything, and they got him to Dartmouth Hitchcock Hospital, it was probably about an hour and a half, and he was in a coma and he never came out of it. So spent the week up there with his 3 kids, just sitting and waiting and hoping for good news, and we never got it. And then we had to make the decision to let him go after 3 days, or his family had to make the decision. And that's where the good part of the story comes. We met with Donor Services. Dan was a strong believer in it, and he had spoken to his kids and his wife about it. And I'll never forget that meeting when the Donor Services rep came in and asked what they wanted to do. And they said, we know what Dad wanted, and we want to honor his wishes. So it was really powerful to see them. Obviously a hard decision, but it was the only good thing that came out of that. About a year later, Deb got a letter in the mail from Donor Services, and they outlined what benefits, who had benefited from his decision. And there was over 85 people from a gentleman, I think he was out in Arizona, got his cornea to restore his eyesight. 4 women got tissue, skin grafts to help with breast cancer surgery. And over 80 people worldwide got bone grafts. So just, it was the worst week of our life, but at least there's something good that came out of it. And so I think my message today would just be I never really thought about it much. I've always had the card in my license, on the back of my license, and said, yeah, I want to do that, but I never really thought about it much until that happened. So I would my message would be, get educated about it. If it's the right thing for you, make that decision and sign up. And then really importantly, talk to your family and your loved ones about it, because you never know if you're going to have a chance to discuss it with them. And so I've done that with my kids. And my youngest actually just started a chapter of Student Organ Donation Advocates, or they call it SODA, out at UMass Amherst. So I've had that discussion, and I feel good about it, and feel that they'll honor my wishes if and when that terrible thing has to happen. So thanks for your time. Appreciate you having me today.
Thank you, Kent, for sharing your story. Next, I have Ingrid Palacio. She has been part of the mission of saving and healing lives through organ and tissue donation for the past 14 years. She currently works as a multicultural community outreach program manager at New England Donor Services, where she develops cultural intelligent programs to provide education about organ and tissue donation in English and Spanish, and promotes donor registration within diverse multicultural, multi-ethnic communities throughout New England. Please help me welcome Ingrid. Thank you. You should be able to.
Here, perfect. Thank you, everyone. Happy Donate Life Month, everyone. Buenas tardes. I am very excited to be here today and with Kent and Billy, sharing for you the miracles that can happen through organ donation and the gift of life. So as Danielle mentioned, I work with New England Donor Services, who's the organ procurement organization, the oldest organ procurement organization in the country. We were founded in 1968 and assigned by the federal government to do the recovery, the procurement of organs for donation and for organ donation and research in all the 6 states of New England and the island of Bermuda. Our mission, as Dr. Patel mentioned, is to save and heal lives through organ and tissue donation. We serve about 50 million people, about 200 hospitals, 14 transplant centers, and 35 transplant programs. Donor families, as Kent shared, are in the core of the work that we do. So what is organ donation? Organ donation is the altruistic process of giving an organ to save or improve someone else's lives through transplantation. Transplantation is necessary for someone whose organ function has failed because of disease, injury, or someone that needs an organ to survive or to improve their health. What organs can be donated? The heart, the lung, the kidneys. Everybody knows that we can live with one kidney, so a kidney donor that donates both kidneys can save 2 people. Same with the liver. It can be donated as a whole or splitted. Pancreas and intestine. The tissues that can be donated are corneas, who give eyesight, the eyesight for 2 people actually, bone, tendon, skin, heart for valves, pericardium, blood vessels, and arteriolia graft. Kent also mentioned about the skin In New England Donor Services, 2/3 of our scheme goes to survivors of breast cancer that they need double mastectomies or need skins to recover range of motion for reconstructive surgery. Also, this is something very neat I like to include in my presentations because we are pioneers when it comes to vascular composite allograft. I hope I'm pronouncing that correctly. We call it VCA. You can see the picture there of Dallas Waynes. He was the first full facial transplant was performed here at the Brigham in Boston in 2011. So just this past March was also 14 years for him with his new face. He had an accident at his church where he got electrocuted. And as you can see, the before and after is amazing. He received the first full facial transplant. But as you can see there, there are other BCA transplantations that can occur and have occurred. But we're very proud that in New England, in Boston, we have been helpful facilitating for that to happen. The types of donation that we are involved, because New England Donor Services, our focus is in deceased donation. And so after brain death, somebody can become a donor. After circulatory death, somebody can become a donor, and also living donation. Through living donation, people can donate part of their liver and kidneys. And so that is something that we are indirectly involving, but it's not the core of the work that we do. Our focus is disease donation. So the organ donation process, some of you might be familiar. This is very far for me to see. We are involved in almost all these part of the donation process. The diagnosis, as you know, comes from the hospital. We are not involved in the diagnosis of somebody getting declared brain dead or when other decisions are being made or prognoses are being given. But we work very collaboratively with, like I say, almost 200 hospitals, including Sterling Memorial, where you guys are the ones in charge of doing the referral for us. So when someone hits the criteria that I'm sure Kim had shared with you guys and when to call us, you guys are doing a timely referral. When that referral happens, usually two teams or several teams, or mainly two teams in New England Donor Services are involved and are called. I had the blessing and the privilege I worked for 8 years as a family services coordinator for the family services department. And I had the blessing to be able to be involved in those discussions, the family discussions when someone was losing their loved one. And have that family discussion is something that continues to be something very collaboratively. We do that in conjunction with the hospital, and everyone in the staff and the medical team that's involved with that case. There are several aspects that we also take care of, like cultural aspects, linguistic aspects. So anybody that's involved in that patient's care and is working with the family are going to be involved with us to make a plan to be able to have a compassionate and effective family discussion. So in that family discussion, we also will see if that person is registered as an organ donor, and if it's not, then we will talk to the family for them to make a decision. Like Kent mentioned, this is a decision that we urge and we encourage for everyone to share with their families. Then the clinical side of things are going to be doing the medical evaluation once we get the consent from the family, or if someone is already registered, we're there to honor their wish or their decision to be an organ donor. Not everyone that wants to be an organ donor, unfortunately, die in the circumstances that can become an organ donor. That's why our clinical team will be doing the medical examination to determine what organs are suitable for donation and if someone is actually eligible to become a donor. So if that's the case, then the matching part occurs. I used to describe to the families or share with them that before their loved one will go to the OR, we already knew who's gonna receive their organs. We already had to have matches. And this is because this is a very sensitive process. I'm just like going over very quickly because this is the nature of this presentation. However, it's being said that in one case, for someone to become a donor and for someone to get transplanted, it involves about 200 people. I don't know, I haven't proved that, fact-checked it, but I have heard it a couple of times, so I thought that was very interesting. So then, as you know, there is the part of the surgical recovery of organs. Is once we have found those matches and once the family has said their goodbyes to their loved one, we support the family through the process and go to the operating room where the donors are treated with the utmost respect. All donors are considered heroes. So we take a moment of silence, and when I say we, it's the team that is in the operating room, take a moment of silence for that hero that's giving life, the gift of life to others. And the medical team also read a statement that the family had wrote about that person, and then they start the recovery. Transplant surgeons are involved in that, and also our teams are surgical recovery teams. They do the preservation and the transportation of the organs, and then they leave the OR for transplantation, where we're not involved any longer. This is, the transplant centers and the transplant programs, transplant surgeons and doctors and such are the ones involved in that piece. And then after that, we continue through our aftercare program. I don't have it there, but I have to add it. Up to a year or more, we will continue supporting our donor families and informing them who received the organs of their loved one. We don't disclose demographics or anything like that for confidentiality reasons, but we will say, maybe the gender and the age range of the person that received the organ. So our work is important because this is the need. As of yesterday, there are about 105,000 men, women, children in the waiting list waiting for an organ to survive. Pediatric cases are up to like 2,000 children are waiting for organs. 61 of those waiting are people of color from multi-ethnic and multicultural backgrounds. And this is because racially diverse populations have much higher rates of high blood pressure, diabetes, obesity, and heart disease, which could put us at risk at some point to need a transplant. African Americans are 4 times as likely, and Hispanics are 2 times more likely to have kidney failure than Caucasians or those from the white race. Every 8 minutes, a new patient is added to the organ transplant waiting list. 16 people sadly die each day waiting for an organ they never received. Thankfully, 1 organ, eye, and tissue donor can save and heal more than 75 lives. So we have that power to help. Who's waiting? And this is something that I also like to show because, especially to my multicultural communities, because like at least in the Latino community and other communities of color, people don't think that this could happen to us. And it's very prevalent. So this is something to kind of put in perspective how this affects us all. And this is who's waiting for life-saving transplant in the US by organ. As you can see, the kidneys are the ones that are needed the most, with almost 91,000 people in the US waiting for kidneys, followed by liver, and then heart, and so on. So you can see there what's the need by organ. Thankfully, like this hospital, we want to thank and take advantage of the celebration of this observance to thank Sturdy Memorial for the collaboration that has had with New England Donor Services throughout the years. I know Dr. Patel mentioned what you guys have done this past year, but since we took it a little farther, so since 2022 to today, 4 organ donors, 8 organs have been transplanted because of those organ donors, 3 livers, 5 kidneys, 62 tissue donors. As I mentioned before, 1 tissue donor can transform the lives of up to 75 people. So you do the math there. And then as far as New England Donor Services, we had another record year. Every year we have a record year. Last year we were able to do 648 donors, who we thank them every single day, but especially during this month. And because of them, we were able to do over 1,500 organ transplants, which is an 80 increase in organ donors since 2020. As a nation, as a whole nation, we were able to do more than 48,000 transplants in 2024, which put us as, I would say, the best. US is the best country in the world when it comes to transplantation. Very, very, very close to Spain. So even though all this work is being done, and even though all our efforts, we 90% of Americans that are in favor of organ donation, but only 50% are registered. So the work continues. We have about 170 million people that are registered in the United States. However, we need more people to say yes to donation. And a lot of people, as you can see, 90% is in favor, but there's a lot of myths and misconceptions that are perpetuated sometimes by movies, series, the media, and for us immigrants, it's sometimes the systems that we come from our countries are very different, the organ donation, how that functions in our countries comparing to in the United States. So one of the major myths, I would say the most common myths that I hear across all cultures and cultural backgrounds is if I am registered and as an organ donor in my license, if I have the little heart on my license, the medical team won't make any effort to save my life because they would like to take my organs. And so that obviously I'm preaching to the choir here because I know you guys know that, the only priority is to save that patient's life. Nobody is more important than the others. So, but we also explained that only 3 in 1,000 people die in a way that allows for organ donation to happen. So it is a very, I consider it a privilege to die in the circumstances to be able to become a donor, regardless if you're registered or not. Another one is religion. A lot of people cite religion as a reason not to donate, but a lot of people don't know or don't. I will always encourage if you are a person that's religious, respect your religion, talk to your faith leaders, and learn about what the stand of your religion is. For example, and you can see here in this slide, almost all the mainstream religions in the whole world are in favor of donation. In my community, for example, where Catholicism is prevalent, Pope Francis says and describes organ donation as a testimony of love for our neighbor. And many other religions that don't have a strong stand pro-donation, at least are not against it, and they leave it to the individual to make the decision. So check with your faith leaders. Age. Older people cannot donate. I hear this a lot in the community. When I do my work in the community, they say, I would love to, but I'm too old. You don't want my organs. There's people that even remove their registration from their license when they reach a certain age because they feel that they won't be able to donate organs. So I'm here to tell you, last year, we had, the United States, no NEDS, but I don't remember what OPO did this, but we had a donor that was 98 years old. He was able to donate his liver. So I always say to people, don't rule yourself out. If you feel in your heart that you want to help people once you don't need your organs anymore, let the specialist to do their job. We will never recover an organ that's not good, suitable for transplantation. Cost, some people think that donor families will have to pay if they become donors, and the reality is, well, the fact is that organ procurement organizations like New England Donor Services, we're 56 organ procurement organizations in the country, each one of us are assigned to a certain region. We are financially responsible to pay for the process of donation. Medical condition, I have a medical condition that does not allow me to become a donor. I hear this a lot in the community, people thinking that because they have either diabetes or high blood pressure or other type of conditions that could prevent them from becoming organ donors. And again, I say, let the specialists to do their evaluation and to find out what organs are suitable. There are very, very few conditions that will prevent you from becoming an organ donor. That could be an active cancer or a multisystemic organ failure. Other than that, even HIV. I don't know if you know, since 2013, President Obama signed the HOPE Act, which allows for HIV patients to receive organs from HIV donors. So hepatitis C, as you know, that's something that can be now, I say now, it's been very several years, cured. So sometimes Hep C patients could be, Hep C donors could donate to even non-Hep C patients because Hep C can be cured after transplant. LGBTQ, people from the LGBTQ community cannot donate. There is a little bit of confusion sometimes when it comes to this because there are more strict criteria when it comes to blood donation, which were not involved in that piece. So when it comes to organs, there's not any regulation or anything that said that people from the LGBTQ plus community cannot become donors. Financial and social status, rich or famous people in the waiting list gets organ faster. So some people will think that this is the reality. The fact is that a national computer system matches donated organs to recipients. Factors used in matching, as you might know, include blood type, time waiting, how sick the person is, demographics, location, and other important medical information. Income or celebrity status is never considered. So that is something that sometimes in the media could get perpetuated. So how can you register as organ donor? If you're not registered yet, please, we have a QR code in the table. You can do it today. It takes literally minutes, like 1 or 2 minutes. People can register as young as 15 or 16 years old when they're getting their driver's permit, when you're going to renew your driver license or get your ID in the DMV or RMV or the AAA. The people that are iPhone users, you can use the application, the Health app, and you can register there, or you can register online in registerme.org or donevida.org if you speak Spanish. And before we go to the Q&A, I would like to introduce our next speaker. And I don't know if Danielle will. Yes, please.
Thank you, Ingrid. And thank you to all at New England Donor Services for all the partnering that they do with us here at Sturdy. Next, I would like to introduce Billy. A 47-year-old husband and father of 7 fell ill in October of 2021 with double lung pneumonia, which quickly turned into ARDS, or ARDS, and lung failure. He was intubated for 11 days and by the grace of God survived, but with some fibrosis of the lungs. Fast forward to February 2024, in a rare occurrence, he went into lung failure with ARDS for the second time. The hope initially was while being intubated and with some time on ECMO, his lungs would make a recovery. But as time passed and with how fibrosis of the lungs it became, the only hope for survival was bilateral lung transplant. Thank you, Billy, for sharing. And his wife Stephanie's here too, if she would like to come up.
Hi, I'm Billy Curtis, lung transplant recipient, and Kent, I gotta tell you, your brother's an angel, he's one of God's angels, along with nurses, donor services, these doctors. He choked me up a little bit, because of this gift. I'm able to be a father to my 7 children, a husband to my wife Stephanie. I guess I'll tell you my story. So in 2021, actually it started before that, I kind of had a life-changing event a few years before that. I'm in recovery, and my life changed in 2019. I got clean and sober, and I have a strong faith in God, which helped that too. And I became very healthy and active, which helped in my recovery. And I was actually running a triathlon when I got sick. I was in great health. I got COVID in 2021. It was the end of September. I ran a race, and then I came home and I felt okay. I had the sniffles, and kind of minimized it. And a couple days later, my wife told me I looked real lethargic, and so I went to the hospital. Well, she checked my oxygen saturation. It's supposed to be in the upper 90s, and I think it was at like 53%. And I walked into the hospital. I don't know how, but I did, and from that point, I went on a ventilator. I was induced to a coma for 11 days, and I went to a rehab after that for a couple months, and I was on oxygen, a high level of oxygen, and I was told, I was probably going to be on oxygen for the rest of my life, and I'd managed. I had a lot of scarring in my lungs, and I was given a gift of life through recovery too, and I worked hard to get out of my own prison, and so I worked really hard to recover from ARDS, and I couldn't run the way I used to, but I exercised. I went back to work, and I weaned my way off of oxygen after like 8 months, and I adapted. My life became normal, and I worked full time. Was involved in my kids' lives very much. I played sports too. I lived an active lifestyle, and in 2024, right after Valentine's Day, I kind of just adapted, and I didn't realize there was anything wrong with my lungs. I got the flu right after Valentine's Day, and my wife again made me go to the hospital. My breathing wasn't. It didn't feel right, and I went to the hospital, and I told them right away. I said I don't want to go on a ventilator. It depleted my body the first time. I lost 60 pounds, and all I was thinking of was how hard it was going to be to get back to par again, and I didn't have any option really. My lungs were completely fibrotic, and that's where a lot of my puzzle pieces are missing. I woke up March 7th, and I couldn't talk, and my wife was looking at me, and I was in a hospital, and I had a trach, so I couldn't talk. And I didn't know what happened. And she told me I had a lung transplant, double lung transplant, and you know, and then she helped me fill in the missing pieces. There was a lot to it, you know, a lot of decisions she had to make. Anyway, so I received a double lung transplant, a gift, a blessing, you know. It was a miracle, and I am truly grateful. It you know, changed my outlook on life, and I'm not very good at public speaking, and but it wasn't an option for me to say no to come share my story, because you know, someone shared their story with me too. A friend of my brother's has cystic fibrosis. He's had it his whole life, and he received a double lung transplant. And when I woke up, you know, I was in the hospital for a while, but you know, things were going well. Actually, real well. I pushed hard. I went to rehab in Boston. After my transplant, it was maybe a month after. I think I went April. I don't know, a month or so after I received the transplant, and I was told I'm in for, you know, a long recovery, and at this point I just wanted to get home. I missed my kids. You know, I was overwhelmed with gratitude, and I hadn't seen anyone in a while. You know, they'd come and visit, but I just wanted to be home, you know. And they told me, you know, it's going to be a few more months. And I pushed hard. I ended up going home in 6 days. After that, I worked really hard. Well, I had a lot of support too, you know, from my family and my children and friends. But anyway, the reason I wanted to share my story is because, you know, my friend that came to my house after, there was a lot of questions doctors couldn't answer, you know, the feelings, the helplessness, not just the medical stuff, you know, you gotta take this pill, that pill, and, you know, you gotta wear a mask, you can't do this, but the emotional stuff, you know what I mean, the anxiety. I've never had anxiety like I did, and you know, it was a big change, but, you know, through my faith in God and friends and support and doctors and my family, I adapted, and you know, and my children have a dad today, you know. I was able to, I watched my son play baseball last June. They won the state championship, and I was there. I think, I don't know, I came home in April, and in May, I get to see my 7-year-old at a dance recital. You know, saved my life. Your brother's an angel, you know. I mean, many people saved my life too, and not only mine. You know, they gave, you know, my wife a husband and my children a father, and someone that can speak to somebody else that's going to go through this or has gone through this that survived. You know, I'm able to share the message that you can live, you can adapt, you can be happy, and I live a full life today. I work full time. I go to the gym. Well, I try to go 7 days a week, but my wife limits me. I live a very active lifestyle. I'm starting. I play softball again, and I couldn't walk. I was on oxygen, you know, and through this gift, you know, not only I get to live a full life, but my children have a 100% dad. You know, my wife has a 100% husband, you know, and yeah, I'm truly grateful. I'm honored that you asked me to come here, and you know, and I'm truly grateful for your brother and everyone like him in donor services that you know, can save another dad's life or mother or you know, anyone. You know, it was a blessing, and I don't forget that. You know, changed my outlook on life, which, you know, I've had a lot of gifts in my life, and I'm truly grateful. So I don't really know what else more to say, but thank you.
Now we just have question and answer, so I don't know if Ingrid and your team, if you want to come up, and if anyone has any questions, whether it's for the New England Donor Services team, or if you have any questions for either Kent or Billy, I'm sure they will be happy to answer any questions you might have for them as well.
Thank you, Anya.
Thank you, Billy, for sharing that. Because of you, we do the work that we do, you know, and thank you, Kent, because of, you know, the donors, is that people like Billy are alive, so thank you. If you have any questions or comments for Kent and Billy.
You mentioned that you're involved with the donors and the donor families for more than a year following the surgeries. Do they have support groups for both parties? You know, you were just talking to me about the emotional aspect of it, and I'm just thinking it might be helpful if they had an opportunity to talk to other people that have been through that.
Yeah, we don't have, and Kate, correct me if I'm wrong, because I haven't been in the Family Services Department for a few years, but aftercare, we don't have support groups per se. However, we have our aftercare counselors that, you know, follow up with the family on an individual basis. And also a lot of our donor families and also recipients are part of our volunteer group in New England Donor Services. So it's not like an official support group, but there are, like, you know, a lot of donor families that get together in events, the same with recipients. But formally, we don't have support groups, right?
We have a partnership with a foundation called Taylor's Gift Foundation, and through Taylor's Gift Foundation, so through Taylor's Gift Foundation, we do have available support groups that we are able to help link families. So when we meet with donor families in the hospital, that is part of, you know, the information that we share with them. This resource, it's free to all of, you know, the families that we work with, and they can access it at any point. So even if it's 6 months down the road, a year down the road, that their family's ready. And on an individual basis too, our family service coordinators do provide to the donor families, you know, local resources to them as well for counseling and things like that to help link them up as well.
Great question.
I don't have a question, just a comment that we're part of a few Facebook lung transplant support groups that have been like super beneficial for just hearing people's testimony of what they've gone through, compare and contrast to what we are going through. So.
Yeah, I know several transplant programs have those type of groups for the recipients, but in the donor side, it's good to know that we're partnered with Taylor Foundation. Any other comments or questions?
Yes, I have a question about, you were showing the demographics slide, and it's more of a curiosity on my end. So you have unknown, so there's like 747 people who are unknown. Does it become more difficult to connect someone with a transplant or an organ if they don't know what race, ethnicity, language the person speaks? So like those unknown people, they have a harder time. Do you even know these?
You and I are in the same boat. Because every time I do that slide, and like when I go to multiracial, I'm like, I can kind of understand people, especially, you know, like you don't, but then I'm like, unknown. So how are we dealing with these unknown people? Like, I don't know if Kim has any idea on your side since you're being with us forever.
I don't really have an answer to the question. Other than I think it could be difficult to match, but it's all done by blood work essentially. So in the end, you are getting your blood drawn, so they're able to do it based on blood. But as far as other, I don't know why it's unknown.
Yeah, because we don't have that. We don't input, you know, in the waiting list. This is not the side that we do. Like Kim said, we have our part of the job is in the matching piece, and so. But even though, if you, I mean, we encourage all races to donate because there have been some studies where, you know, in the long term, the same, if you do transplant from the same race, right, or ethnicity into a patient that needs an organ, it seems like those transplants will be like last longer, or yes. That has been studies on that, but then, you can donate across races and ethnicities. So I guess that unknown piece gets taken care of on that, right? But yeah, every time, me too. I'm like, but I have to put it, because then when you see the total of the people, then if I take the unknown out, so I'm like, I'm just gonna put it there, anyways, exactly how it comes. That's a very good question, and I promise you, I'm gonna find out, because now I'm like, I need to know how that works.
Yeah, I think, I know, we're in healthcare too, so like we could do
Yeah.
better. We could make sure we get our patients to report back the
Yeah.
information so that y'all don't have those unknowns too. So
Yeah.
that's why I'm trying to connect the piece on what we could do better too.
I love it. I promise you, I'm gonna find out. I promise you. Anybody else?
Yeah.
Oh, yes, sir.
Are there still any issues with a recipient's body rejecting a donation?
Yeah, of course. That's, think about organ donation and transplant as a treatment, not as a cure. Transplant is not a cure. Like that is something that we need to all be aware of. And so with the transplant, and Billy can speak to that better than me, they're always gonna have to be taken for life, a lot of medications, so they prevent the body from rejecting it. I know there are several researchers and companies working on helping that, so the patients wouldn't have to be in those medications, anti-rejection medications for life, but that is still in the works. But yeah, that is a risk that they all face every day. So that's what the lifestyle changes, the medications, following the treatment and everything, so important.
So is it generally manageable though?
Well, yeah, of course, yeah. It's generally manageable. Do you want to add anything to that?
Yeah, I mean, it is, it's a lot. In the beginning, it was overwhelming. I mean, like I said, I'm in recovery. I don't take anything, I don't even take Advil anymore, and so it was life-changing. I was taking like 30 pills a day in the beginning. They work it out, so I'm on anti-rejection meds for the rest of my life. I have to take, my wife really knows better than I do.
The big ones are the anti-rejection and the immunosuppressant, right? So you're used to living this healthy life, but you have to, they have to kick down your immune system so your body doesn't reject that organ. So it's a balance, and then the transplant meds also affect other organs. So often you'll see a lung transplant recipient. We met one 10 years out. He needed a kidney or liver transplant because one of the meds just kind of really affected those organs. So it's just a balancing act and a constant relationship with doctors to make sure like everything's staying in check.
I had a friend too that my friend that had cystic fibrosis, he actually had to have a second double lung transplant because he went into rejection. But yeah, so it's a...
The meds are a big piece.
Yeah.
Yeah.
Thank you. Thank you, that's a good question. Any other questions or comments?
I have a comment. You're inspirational, and the next time I don't feel like going to the gym, I'm gonna think of you. Don't be so lazy.
The reason that I shared those pictures too, in particular, was because it was before he was sick in 2021, then he got down to 115 pounds. Then he came back, that one shirt with him like kind of like really jacked up, that was 2 weeks before he got sick.
Yeah.
And then 2 weeks, he was at the peak health of his life. He was so healthy, and then he went into lung failure again, and he got down to 115 pounds again, and then it was, today, I mean, he works hard every single day. And they also said that's why, a big portion of why they could save his life, so, because, how do I say this? So, like, people who are on life support and dying while acutely ill, they're not necessarily people who get transplants.
Yes.
Right, so, but
Sometimes
because,
you're too sick.
right,
Yeah, that's
and he was, but because of all of his other organs and because of the shape he was in, they literally said to me, Stephanie, if we don't save this guy's life, whose life will be saved? They would joke and say, man, this guy's heart, the pressure he's under, and this guy has the heart of a lion. So it was just a miracle all around.
Yeah, thank you for sharing that. He's definitely an inspiration. I was putting the slides together and putting his pictures, and then I'm like, how? No, this is not right, because he was, the way that he looked, and I'm like, no, I kept going into the slides. I'm like, okay, I'm just gonna go for a date till I put it in here. But yeah, 100% inspired, yeah. I even showed my husband, like, look, you have no excuse. Get up.
He has a mindset, it's just different, you know?
Yes,
He's very
yes.
motivated to live and live to the fullest, you know?
Yeah, what a miracle. Thank you so much. Thank you, both of you, for being here, for sharing, and Kent and everyone for inviting us to be here and sharing this, which, you know, we are so committed and so invested from every side of us. So thank you so much, and continue celebrating National Donate Life Month. And if, you know, there's some goodies and some stuff there in our table, please feel free to take them. And if you haven't registered yet, we also have a QR code that you can scan there to register. Thank you very much.